Ну, у нас, видишь, мнения разделились. Я считаю, что редко встречается. У нас Игорь Юрьевич считает, что часто.
So, it is difficult to say about antibiotic resistance in our country. We have different minds about, we have different statistics. And there are some cases with antibiotic resistance in big hospital, and it is very often in patients that are in intensive care unit. Intensive care unit and reanimation, it is very often. Normally, in surgery, normally in practice, it's not so often like in intensive care unit. That it is also often in patients that that have primary immunodeficiencies and secondary
immunodeficiencies.
immunodeficiencies.
Еще с грибковой инфекцией.
Yes, and it is also in patients with AIDS and fungal infection.
Бактериологическим состоянием больницы и операционным.
Это государственная
Служба,
да.
служба на Санбеднадзор.
Generally, in every city, in our country, in every city, we have governmental department for control of infection diseases and for control of antibiotic resistance. It is governmental. But in every hospital, we have clinical pharmacologists that these people, they control in infectional diseases and antibiotics in hospital. And also it is popular in Russia to use bacteriophages. You know bacteriophages? Yes, for treatment. And it is also, we have also option for use bacteriophages into peritoneal cavity, into urine cavity, and so on. Normally, in surgical departments, for example, Igor works or I work, every week came bacteriologist to do investigations in operating theater, in patient room, and in all department, to see what is it, which kind of flora is in department normally. And we try to use antibiotics only if there are indications for it. For example, we don't use antibiotics for patients that have not indications. Therefore, it is best control for antibiotic resistance in our hospital. Only do it in patients who have indications for antibiotics. In a few years, we will make protocols to use antibiotics only for patients who have indications for it. For example, Yulia, she's thinking that bacteria is not a problem for us. If we will use antibiotics rationally, it will not a problem. She's thinking about viral infections. Viruses, it is more problematic for patients than bacteria. Therefore, we have positive minds about our future, and we think that rationally using of antibiotics, it is the best way for stop antibiotic resistance.
Оставьте антибиотики реально для больных.
Save the pill for the really ill.